2012 Szent-Györgyi Prize co-winner, Dr. Zhen-Yi.
Respected Mr. Franklin Salisbury, President of the National Foundation for Cancer Research, Honorable Mr. Billy Towson, Congressman of the United States of America, respected Dr. Zhu Chen, co-chair of the Szent-Györgyi Prize Search Committee and Chief Operating Officer of the National Foundation for Cancer Research, distinguished leaders of cancer research from academia, industry, and charity, dear colleagues and friends, ladies and gentlemen. It is truly a great pleasure and honor for me, together with Professor Zhen-Yi to attend the award ceremony of the 7th Szent-Györgyi Prize of the National Foundation for Cancer Research. I have to say that Professor Wang has been my mentor for life. At the age of 88, he still works in Beijing Hospital to see the patients and to teach the young doctors. And one of his hobby is to discuss with the young doctors very difficult cases. And sometimes students and the young doctors made some tests to him, but he never failed. I would like to take this opportunity to thank the chair and the co-chair and all members of the selection committee of Szent-Györgyi Prize for nominating Professor Zhen-Yi and myself as this year's awardees. I thank the National Foundation for Cancer Research for your strong leadership and support. My thanks also go to colleagues and friends from China, the United States, and other countries who have contributed to the work of this year's prize. The prestige of the Szent-Györgyi Prize lies on both innovation and humanity, as so nicely explained by Dr. He Wu. To be honest, I just learned this story about Dr. Albert Szent-Györgyi. He's not only a great scientist, but a great man of humanism. So I also recall one of my mentors in France, Professor Jean Dosset. Actually, he's a Nobel laureate for the discovery of the HLA, very important for our immune system, but also for the transplantation medicine. And during the Second World War, actually, he followed General de Gaulle for the great cause against fascism. Prevention, control, and treatment of cancer have always been a field full of challenges, calling for breakthroughs in research frontiers and also system improvement in quality care. Like many colleagues in hematology and oncology, conquering leukemia has been a dream in my life. However, as a student of Professor Wang, I fully understand that any achievements is the result of teamwork and very often continuous efforts of generations. If we look back to the history of the fight against APL, then it is a story of 30 years' work of 4 generations. Over the past 3.5 decades, I have been working with Professor Wang on the understanding and the treatment of APL. Through discovering the molecular and cellular mechanisms underlying both the pathogenesis of leukemia and the therapeutic effect of all-trans retinoic acid and arsenic trioxide, in the project of which I have the chance to be the principal investigator at Shanghai Institute of Hematology, Beijing Hospital of School of Medicine of Shanghai Jiaotong University. We have developed the concept of synergistic targeting therapy against the oncoprotein PML-RARA as a key driver of the disease, so nicely reviewed by Professor Wang just a little while. The retinoic acid, arsenic, and the chemotherapy combination finally turned APL from once a lethal blood cancer to a highly curable disease with a 5-year survival rate of 95%. The successful battle against APL is the story of East meets West, where the Confucius philosophy and more than 2,000 years of practice with arsenic compounds in traditional Chinese medicine were converged with the modern biomedical sciences. Over the time and through these studies, we have also developed deep friendship with our collaborators in China, in the United States, in France, in Japan, and in many other countries as well. Here, I wish to especially acknowledge Dr. Zhu Chen, who is my wife. As you know, over the past 12 years, I have been working mostly in Beijing. And if I succeeded Professor Wang to be the director of the Shanghai Institute of Hematology, then Zhu succeeded me 8 years ago as the head of this institute. Actually, she led the most recent work on the combination of the 2 agents to finally conquer this leukemia. I also wish to mention the name of a great hematologist practicing both traditional Chinese medicine and modern hematology, Professor Ting-Dong Zhang from Harbin Medical University. Professor Wang showed one slide on the contribution of Professor Ting-Dong Zhang. Actually, during the Cultural Revolution in the early 1970s, he and some other doctors discovered the therapeutic effect of arsenic trioxide against certain types of cancer, including some types of leukemia. at that time, and we were fortunate enough to establish a collaboration with him in mid-1990s. I have also to thank Professor Samuel Waxman from Mount Sinai Medical Center in New York. Professor Wang already mentioned about this long-term collaboration and deep friendship. I would like to add one more thing. The first paper on the use of retinoic acid in the treatment of APL was sent by Professor Wang to Blood in 1987. But the manuscript was rejected. The first time, the reviewer said, the science is not good. Why? As explained by Professor Wang, some people before him used retinoic acid to treat AML, acute myeloid leukemia, but they were using 13-cis retinoic acid instead of all trans. That's why the reviewer thought that retinoic acid was ineffective. Of course, Professor Wang explained that this is not the 13-cis, but all trans. However, the manuscript was rejected once again. And they said that this is not English, but the Chinglish. And then it happened that Professor Samuel Waxman visited Professor Wang, Shanghai Regional Hospital, and Professor Wang showed him the sad story. And this time Professor Waxman said, okay, I will assist you to write a paper. Of course, this time in good English instead of Chinglish. And then Professor Waxman wrote a letter to the editor-in-chief of Blood saying that you should accept this paper because it was rewritten by a native English-speaking people. Now the story is not finished. Professor Wang would like to invite Sam to be the co-author, but Professor Waxman this time rejected that. He said, I'm your friend, just lend a hand of help to you, but I won't be the co-author of this paper. So his name was mentioned in the acknowledgement of that historic paper. Of course, I have also to mention Professor Laurent Degoes and Dr. Hugues Day in Saint Louis Hospital in Paris. As a matter of fact, the group of Professor Laurent Degoes was the first outside China to confirm the therapeutic effect of all-trans retinoic acid in APL. But at that time, all-trans retinoic acid was not available in Paris. So Professor Wang asked several people to carry the drugs. I cannot say this is a smuggling because for goodwill, to Paris, and then Laurent was able to use medicines to treat patients. And then, I'm not sure if it is true, but Laurent told me that he did the same thing for Dr. Raymond Warrell, who is also in the audience. So the effect was also confirmed by doctors from St. Catherine Cancer Center in the United States. So we are also grateful to our patients, I have to say, who have been so generously supporting our work without any reservation, and cooperating with us even at the most difficult time of their life. Professor Wang very often taught us when I was young that our best teachers are the patients. Their pain, their suffering constitute the basis of discoveries, innovations, and breakthroughs of the medical doctor. I have to say I was truly touched by the address of Billy, who is a prostate cancer survivor. Anyway, personally, I feel fortunate enough to be part of this great team and a great cause. I would like to say that the great honor of Szent-Györgyi Prize is not only for Professor Wang and myself, it also belongs to the whole Chinese medical community. Today's ceremony witnesses a historic moment to further promote the cooperation between China and the US. I think we can never forget this historical visit of President Nixon to China now 40 years ago. And recently we just celebrated this historic visit. I think President Nixon, President Mao Zedong, Chairman Mao Zedong, and Premier Zhou Enlai should be always remembered by us and also by our next generations. They are people of vision. And 2 years ago, I got the honor to accompany Premier Wen Jiabao to New York to attend the UN Summit meeting on the maternal and child health. And in addition to the events at the level of United Nations, Premier Wen Jiabao also met a group of leaders in different sectors in the United States. I remember very well the dialogue between Premier Wen and Dr. Kissinger. Both believe that our two great nations should be always troubled by issues like currency ratio. We need to think in a strategic way the future of the mankind, the maintenance of the peace of the world, not only for us, but also for our next generations. So I think cancer research should be a strategic area for cooperation, for in-depth and large-scale cooperation between our two countries. As the Chinese Minister of Health, today I have even greater and a clearer sense of responsibility to push forward the healthcare reform in China in order to help those people for whom appropriate care is mostly needed. I think scientific basic research, clinical medicine, and health policy should be connected with each other. Scientific research results can be translated into applicable, cost-effective public health interventions and clinical therapeutics. Whereas evidence-based policy making can maximize the results of scientific research and clinical intervention by making them an integral part of the health care and the social security system, which will not only benefit the patients and the general public, but also promote and re-energize scientific research development. Without a health system of equity and accessibility, we cannot win the war against diseases such as cancer. Therefore, I'm proud of the ongoing Chinese healthcare reform, which has established universal coverage of essential health insurance and health delivery system for 1.3 billion population in 3 years, saving millions of lives. And just before my departure for New York, I attended this year's annual report of the government by Premier Wen Jiabao. He announced this year the social insurance system should be further improved to cover 20 categories of catastrophic diseases for which the coverage rate or reimbursement rate should reach 90%. And among these 20 categories of diseases, there are 9 types or major forms of human cancer, including lung cancer, digestive cancer, breast cancer, cervical cancer, and leukemias among the children and adults. To be honest, I made a proposal to Premier Wen Jiabao several months ago. So I think we can avoid in the future the sad story of the grandmother of Dr. He Wei-Wu. Of course, we are also studying the feasibility of the vaccination against HPV in China. But I have also to say that I feel very humbled today as a public servant, because China is a country of huge complexity. And when we were talking about progresses or achievements, we should always remember that these things should be divided by 1.3 billion. Nevertheless, if we consider the difficulties and the problems, and these should be multiplied by 1.3 billion. So finally, I would like to say that international cooperation is of key importance for the war against the cancer. Diseases, particularly non-communicable diseases such as cancer couldn't be addressed within a single country in the world of globalization. It is my sincere hope that we, China and US, as well as the global health community, we should work even more closely to tackle the major issues of mankind, such as health, environment protection, and renewable energy in an effort to build a peaceful and harmonious world. Thank you very much.